Hello, everyone. Thank you for joining our interview for today. We finally got a person who is a nursing English student. So we are very excited to have an interview. Could you briefly introduce yourself to the audience?
Hi, my name is Ellen Bang, and I'm currently a graduating senior for the School of Nursing at Rutgers.
Yeah, thank you so much for being on the interview. What is one of the reasons why you chose nursing as your major?
Okay, so um, in high school, I really enjoyed my science courses, and I wanted to do something in the healthcare field, but I didn't want to be a doctor, or I didn't want to go to med school because of the length of the time to be a doctor. The nursing is, if you go for your bachelor's, it's only 4 years as a freshman to senior. There's also like 2-year programs, so accelerated programs if you decide to want to be a nurse later on in your career. And I really liked how first the short schooling and second how it's more of a hands-on job, and so being able to directly care for your patients. And also I just really wanted to wear scrubs when I was in high school, so I was like, oh, like I really like, you know, but yeah, like just being able to directly care for your patients. Also, I feel like you learn the most basic skills of caring for a patient, which can be of help wherever you are. Like I could be walking down the street, and like if there's anyone in need of help physically or whatnot, like I could, do something. So it was
Yeah.
nice.
As a nursing student, course though, compared to other majors, are very tough, right? Is there any recommendations that you would want to give to possible students who are looking to be in nursing school?
So there's a lot of prerequisites you have to take. I guess specifically for Rutgers, freshman, sophomore years, when you take a lot of your science courses, like anatomy, physiology, you take that your freshman year, and you take microbiochem, pathophysiology, pharmacology, in your like sophomore, junior year, and honestly thought like, oh, like I just need to pass this class, and like like I won't have to use it for later on. But something I realized while being in nursing school, especially my junior year, is that you do need to know, especially your anatomy, physiology, your pathophysiology, and um, and your pharmacology, because that comes up. That will, if you don't know that foundation, it gets really hard in junior year. So one thing I recommend is that when you are studying your freshman and sophomore year, whatever subject it is, make sure you're not just trying to pass the class, but really retaining most of the information, so that when you are in your junior year, it's not like something new to you or like something you have to restudy, because that just takes up like a lot of time.
Yeah, I think it's important that building foundation from the very beginning of nursing career, right? As a freshman to senior year, it's really important that you're not only just learning and then forgetting the next year, you're constantly building that foundation so that you can be successful in your junior year and senior year. After being, you're almost at the point where you're graduating, right, from nursing school, what is one of the most important lessons you've learned uh, after completing the nursing school?
I think the most important thing I learned is really, I guess, like time management. I know my junior year, especially, I had no time for anything. I feel like I was just studying every single day. But I wish that, like, if I time managed, or like maybe I went to sleep a little earlier, or um, like spaced out my days more. I think I really learned how to schedule my days instead of just living day by day, like scheduling out so that you have space for yourself too. It's not just like you're in your room studying, or like at the library studying every single day. So time management is something that like was really important to me, and something I learned a lot throughout my college.
I was curious, like, what are some of the possible routes you can take after, um, once you're once you completed the nursing program?
Okay, so what's so great about nursing is that once you get your BSN, which is your bachelor's degree, or even your accelerated, if you're in an accelerated program, whatever degree you get out of nursing, and then you get your RN license. So basically, even though I'm not at school, I still have to take a licensing exam.
Oh.
And I mean, I'm hoping for like in July or August to take it. You want to get as soon as possible. Everything that you learn doesn't just like fly out your brain, but yeah. So you have to once you get that license, you're honestly there's so many things that you can do. You can work at a hospital. You can work at a clinic. You can work for like the community. You can work like there's just so many like opportunities and like where you can be working at, and so I think that's so great about nursing that like I'm not gonna be just stuck into this one place. Or you can go back to school and become a nursing. A lot of people become a nurse practitioner. So just basically, like with that degree, you can prescribe medicine, see your patients and all that. You work with a team of doctors and like physician assistants and all that. So yeah, you can go back to school, and you can become a midwife, you can become a professor. So yeah, there's like a lot of like different options. Personally, I did not want to go back to school because I just think school is not for me. But personally, I really loved my maternity clinical. So like OB, like mother baby, like women's stuff. So I think through my experience and going to various hospitals throughout my nursing school, I really enjoyed my time with like women specifically and mothers specifically. So I plan on working in that department, like labor delivery or something like that. And then over time, though, I really enjoy being with kids too. So I think I might like when I'm like I guess like when I have a family or whatever, like I want to be like a school nurse or like elementary school, help out those kids and yeah. So like, there's a lot of different areas you can go into with your degree, which I really enjoy. So.
Yeah, that's perfect. That's amazing. Thank you so much for sharing what it is to be like a nursing student, taking hard classes, being that foundations to be successful in upcoming junior and senior year. And those are very important for a lot of people, not only for like nursing major, but I'm pretty sure there are many different majors that are as important to build a foundation to be successful once they move on to like junior and senior year. So yeah, let's talk about like like nursing school. You guys have clinical experience, right? That means not only you guys take classes, but you have to go to hospital and like have hands-on experiences. So I was curious, what were some of the experiences that you had and some of the learnings that you've done?
Okay. So for clinicals, it's only for your junior and senior year. I don't know if actually like right now, Rutgers, after I graduate, like the underclassmen have a different uh, curriculum. So I'm not really 100% sure about theirs, but for mine at least, we have clinicals junior and senior year. And what clinicals are is that along with the class that you're taking, specifically med-surg, pediatrics, maternity, med-surg 2, psych, and your leadership. So there's 6 classes that have clinicals. Again, I don't know if the curriculum has the same ones I had. But yeah, those classes, along with your lectures, you have to go in once a week for 6 hours at a specific hospital day per unit. So before each semester, not gonna lie, they were pretty bad with giving out these schedules for where our clinicals would be. So we wouldn't know until maybe like a week before started where we're gonna go. So these hospitals can range from RWJ down in New Brunswick or St. Peter's, or it can be in Newark, it could be in Livingston, like the town.
Wow.
It can be, I had mine in Ridgewood and
Ridgewood,
Bergen. Yeah. And I had one in Hackensack and Bergen.
Wow.
And then some people went to like Princeton. And yeah, so there's like a lot of hospitals. They kind of just like throw you in. So one tip for that is whatever clinical group you're in, ask around. If you don't drive, like ask a carpool with people, and like if you don't have a ride or whatever, that can be a very big issue, I guess. But other than that, yeah, clinical is just 6 hours a week. Some people have it 12 hours every other week. Yeah, but usually that's not the case. But yeah, so clinicals, it was good. I think that most of the time the nurses don't want the students. But I think that if you have a good instructor, they will go around with you and teach you certain things. I would say though, like clinicals was basically what a PCT, like patient care tech at hospitals kind of do, like the basic stuff, vitals and like assessments, you know. But I know other nursing schools are more, um, they do more stuff with the kids, but I know for Rutgers, because of like policy reasons, I don't think they make us do anything invasive. So yeah, that's a clinical experience.
I know like different majors such as business, they have internship during junior year and senior year where they get work experience while they make money. Is there anything that is similar to like nursing students where they also learn but they kind of do it as like a work?
So there are like externships during the summer that they offer in the school, specifically at RWJ or even St. Peter's. I don't know if a lot of nursing students take up the offer unless you're very like into it, I guess. But personally, I didn't just because I felt like clinical experience is very similar to that. Obviously, I think you learn a lot more in those internships and it looks better in the resume. But I know a lot of my friends, they work as a patient care tech, so patient tech at like St. Peter's or WJ, and that's also a good experience as well. It's just pretty hard. I would say if you are going to do that, it should be like your freshman, sophomore year when you have more time. Junior year is pretty hard to balance a job and school at the same time. But
Yeah,
we do have.
it's cool that there's some type of externship, right? Something that is similar to what other major students have. While they make money, they can also build something that can help them make a better resume for getting a job in the future. So yeah, I think it was pretty cool. Yeah, I think we're almost at the last part of the interview. If you were to give a big advice as a nursing student to people who are thinking about maybe is nursing a major something that I can consider or choose? What would it be that advice for those students?
I would say don't do nursing for the salary or anything because I feel like with any other major you can make the same amount that a nurse could ever make. I think that this job is very like if you do it for the money, it can burn you out really quick. You might even want to study something else right away. So I would say for nursing, I feel like it's very important that you really have a passion to help for specific, I guess, like populations, because that's what's gonna keep you going through nursing school. I know a lot of my friends who dropped out because they were just not passionate about it anymore. It was just like not the studying, the work effort that it took to stay in nursing school was just not worth it to them in the end because they just I guess like lost passion for trying to take care of people. So yeah, just like know that you're in your heart that like you really want to do this for a living. You want to help people physically, because you are going to be doing a lot of physical labor, I guess. So unless you're like in like the administrative side of nursing, that's a different story. But yeah. But I think that it's very rewarding in the end, and that there's so many other things you can do that's not hospital related. So don't think that your life is going to be in the hospital for the next like 50 years of your life. There's so many other opportunities. So yeah, that's advice I would give. Just make sure that you really do want to do it, and something that will get you through nursing school is your passion for wanting to help others.
Yeah, I think that was a very good explanation on maybe who should be a good fit for the nursing major or who is not a good fit for the nursing major. I think it's very important that you mentioned about how passionate you are to help people. Like something that helps you to drive and then be motivated to go through the journey to complete nursing school. Because even completing nursing school is not something that is easy compared to other majors. So yeah, I think it's great that you have the heart to help a lot of people and pursuing the career in nursing. So yeah, thank you so much for giving this insightful information for a lot of students. And yeah, one day I hope that people who get this information, once they get to our position, they can also do the same, helping other people. So yeah, thank you for joining us here today, and we'll be back.